Hello everyone, in this video we are going to study about a homeopathic remedy called Cactus grandiflorus. The common name of Cactus grandiflorus is night blooming cereus. Cactus grandiflorus common name is night blooming cereus. The objectives of this session are: describe the drug picture of Cactus grandiflorus, describe the guiding symptoms, cardiac related symptoms, fever characteristics, and the action of cactus on the general body and mind. Introduction. The common name of Cactus grandiflorus is night blooming cereus. It belongs to the family Cactaceae. Family Cactaceae. Source of the cactus is plant kingdom. The parts used are tincture of young stems. So the young stems of cactus are taken and the tincture is prepared out of it. Thermally, cactus is neither hot nor chilly. The miasm, sora, temperament, sanguine. Prover is Rubini from Italy. Sphere of action of cactus. It acts on the heart and blood vessels, uterus and ovary, head and whole body in general. Ailments from the sun, rainy or damp weather, disappointment of love. Ailments from are sun, rainy or damp weather, and disappointment of love. Mental symptoms of cactus: taciturnity. Taciturnity means the people who are highly reserved or conservative, unwilling to speak a word or answer. They do not speak a word nor they answer to what you say. There is unwillingness to speak, taciturnity in cactus, melancholy and sadness. There is fear of death as if he is going to die. The person fears that he is going to die. The fear is so intense that it is going to be shown on his face. Fear is depicted on his face because the pain is so intense. There is an irresistible urge to weep. Weep is to cry. The person has irresistible, which is uncontrollable, desire to cry. The weeping is aggravated on consolation. The person is ill-humored. Cactus screams and cries out with the violent pains, dreams of falling from height. So the cactus dreams of falling from heights. We have to remember 5 C's. There is caged feeling, C for cactus, C for caged feeling in cactus. The caged feeling is found both at the physical and mental level. The guiding symptoms: there is constriction, contraction, congestion found in cactus. So guys, the C, 1 caged feeling, then constriction, contraction, congestion, constrict, contract, congest, constriction, contraction, congestion. The hemorrhages is because of the vascular relaxation and violent congestion. Because of the vascular relaxation, they are going to end up in cardiac conditions and vascular conditions. Since there is hemorrhage, that is loss of blood, there is vascular relaxation and violent congestion. Because of the relaxation, there are cardiac conditions and vascular conditions found in cactus. The last thing is C, from C is collapsed and unclasped heart. So guys, caged feeling, contraction, congestion, constriction, collapsed and unclasped heart. Heart feels as if clasped and unclasped by iron wire. You can see in the picture here, it is clasped and unclasped by an iron wire as if bound and it has no room to beat. Sensation of cord tightly tied around the lower part of the chest. So guys, you can see here the heart is bound by the wires, that is, it is limited by the wires and the heart has no place to beat. Since the wires are bound around it, it has no place to beat and the person feels as if the cord is tightly tied around the lower part of the chest. Next, we move on to the rheumatism. Congestion in joints, constriction as if tied with a tape or bandage. We read that there is going to be a sense of constriction, congestion and contraction. Here in the rheumatism, there is congestion found in the joints and the constriction as if it is being tied with a tape or a bandage. There is tightness, tension and pressure felt. When something is tight, there will be tightness, tension, pressure that is felt in the extremities of the rheumatic people suffering with rheumatism. Extreme weakness. There is icy coldness of the hands and the feet found in rheumatism. So guys, hope it is clear. The rheumatism, you have to remember, the person is going to feel weakness, icy coldness of hands and feet as if the extremities are being bound by a bandage or a tape and the congestion is found in the joints. The chest, there is oppression of chest as if iron band prevented its normal breathing. So you can see here the person feels the breathing is oppressed and there is an iron band which is preventing its breathing and there is a feeling of a weight being kept on the chest. There is constriction in the chest as if bound. Vertigo. The vertigo is from the congestion of the head, vertigo from congestion, vertigo from turning in bed, stooping, rising from a recumbent position, deep inspiration. So the vertigo, you have to remember, the vertigo, when does the vertigo come on? It is during the turning in the bed, stooping, rising from recumbent position and deep inspiration. The periodicity is well marked in Cactus. You have to remember that the periodicity is at 11 a.m. and 11 p.m. Cactus 11 a.m. 11 p.m. The particulars. The CVS or heart. In the CVS, first let us look where the pain is located and how is the sensation of the pain. The pain is located in the apex of the heart. It is shooting down to the left arm and to the end of the fingers. You can look at the picture here. The apex of the heart, then it is shooting down to the left arm and the left fingers. The pain go round to axilla, back and scapula of left side. So pain from the front, it is travelling to the back, axilla and back and the scapula of the left side. The sensation. There is constriction in the heart as if iron band prevented its normal movement. We already read this. A revision to you guys. There is a constriction of the heart as if the iron bands are preventing its normal movement, as if it is clasped and unclasped with an iron band and there is no room for the heart to beat and the heart feels as if it has been caged and each wire is being twisted tighter and tighter. You can look at the picture, there is caged feeling and no room to beat and it is clasped and unclasped by the iron wires and the wires are being twisted tighter and even tighter. So we are done with the location and sensation. Location again guys, apex of heart, left arm and the end of the fingers, travels back from the axilla into the back and the scapula of the left side. The character of the pain. It is going to be fluttering, great irregularity in the heart action, it is pulseless. The modalities, the aggravation is lying on the left side, walking at night. So when the person is lying on the left side and walking, and at night the complaints are going to aggravate, then ameliorated, that is, the complaints are better by rest, fresh air, open air, and after sleep. At night they are going to aggravate, but once the person goes to sleep, the complaints are going to be better. That is, they are ameliorated by rest, fresh air, open air, and after sleep. The concomitants, that is, the associated symptoms along with the cardiovascular symptoms, are the perspiration is going to be cold. The perspiration means sweat, it is cold. Blueness of the face, hot head and hands, icy cold feet. There is congestion found, so blueness of face. Hot head and hands, the top body, hands and head is going to be hot, the feet is going to be cold. Icy coldness feet, hot head and hands. So guys, there is two things found in the fever and in the cardiovascular system. For now, you remember the head and hands are hot, feet are cold in cardiovascular system. Next, in the fever, we are going to see a slight change. The fever every day at the same hour. We read periodicity is found in cactus, so every same hour the fever is going to recur. 11 a.m. and 11 p.m. is the periodicity. The chills start at 10 p.m., that is dinner hour. Type of fever: rheumatic fever and intermittent fever. Cactus is indicated in rheumatic fever and intermittent fever. The three stages of fever, that is heat stage, sweat stage, and first chill stage, heat stage, and the sweat stage. All the three stages there is incomplete. Next, we are going to start with the heat stage. There is hotness and shortness of breath. There is scorching heat at night with a hot face. You can see the scorching heat and the face is hot. In the kid, you can see here the face is red and hot. There is scorching heat and shortness of breath. The chillness is with the chattering of teeth. The chillness is not relieved by covering. In the chill stage, there is going to be chattering of the teeth. It is going to be that severe and it is not relieved by covering. Then in the heat stage, we already read scorching heat, shortness of breath, red hot face. Then we move on into the sweat stage. The heat stage is going to terminate with sweat, that is perspiration. There is coldness of the back and icy coldness of the hands and the feet. Here the comparison, there is coldness of both hands and feet. In the cardiovascular system, the hands were hot. Here the hands are cold in fever. Cactus, fever, coldness of hands, back and feet. Everything cold, cold, cold in fever. Coldness of back, icy coldness of hands and cold feet. So guys, a summarization, the heat stage, sweat stage, chill stage. First chill stage, chattering of teeth and coldness which is not relieved by covering. Then the heat stage, there is shortness of breath, scorching heat with red hot face. Then sweat stage, there is coldness of the hands, feet and back. Head symptoms, there is pulsating headaches which are found on the right side. Congestive type of headaches. The headache as if pressed by a heavy weight on vertex. You can look at the pictures here. There is pulsating headache and congestive types of headache. Headache on the vertex. The picture vertex, there is headache, and as if a heavy weight is kept on the vertex. There are periodic types of headaches at 11 a.m. and 11 p.m. Next, we move on into the respiratory symptoms. First, nose. Nose, there is epistaxis. Then the throat complaints. There is constriction of esophagus, dryness of tongue as if burnt, suffocative constriction of the throat. So, constriction is found and congestion is found in the throat. There is esophagus constriction of esophagus. Nose epistaxis, throat congestion and constriction of esophagus. Then the stomach, there is going to be constriction, pulsation or heaviness in the stomach, and also hematemesis, that is vomiting of blood. Next, the respiratory symptoms. There is oppressed breathing as from a weight on chest. There is constriction of the chest as if bound. So you can see in the picture here, the breathing is being oppressed, that is it has been stopped because of the weight on the chest. There is difficulty in the breathing. Oppressed breathing is because of the weight on the chest. The constriction of the chest is found. Hemoptysis with a convulsive spasmodic cough. You can see here, hemoptysis is nothing but the blood in sputum. The cough is convulsive and spasmodic, which is ending up in hemoptysis. Diaphragmitis with a great difficulty of breathing. The pictures are given, guys. You can look at the picture here. The sputum, the girl coughed and the napkin is having sputum with the blood in it, that is nothing but hemoptysis. There is diaphragmitis with a great difficulty of breathing. The urinary system, there is urinary retention. There is constriction of the neck of bladder causing the retention of urine. So, there is constriction again here, C, constriction. In the neck of the bladder, the constriction of the bladder is causing the retention of urine. Hemorrhage from bladder, clots of blood in urethra. There is constant urination. Now we move on to the female reproductive system, dysmenorrhea. Dysmenorrhea is nothing but painful menses with a pulsating pain in uterus and ovaries. There is vaginismus. The menses are early. They cease on lying down. So the flow of the menses is going to cease on lying down. Stools, hard black stools, diarrhea in morning, hemorrhoids. They are swollen and painful. The sensation of great weight in anus. So guys, a summarization, urinary symptoms, we see there is retention of urine and the hemorrhage from the bladder and clots are found in the urethra. You see the stools, there is hard stools, then diarrhea in the morning. So both alternating, hard stools and diarrhea, they are alternating here. Hard stools are black and then the diarrhea is found in the morning. Along with this, there are hemorrhoids and a weight felt in the anus. Reproductive system, in the female reproductive system, there is dysmenorrhea, painful menses. The menses will come early and the flow is going to cease when the person lies down. Along with it, there is vaginismus. Now we move on to the extremities. The extremities, there is a sensation of a cord tightly tied around. Then there are edema of the hands and the feet. The hands and the feet are swollen. Swelling is found, that is edema of the hands and the feet. The legs are restless. The feet is enlarged. There is icy coldness of the hands. So you have to remember, the hands are icy cold, the legs are restless, and the numbness is found on the left arm. The hands are going to be soft. So guys, we start with hands and feet. 1. Edema of hands and feet. Hands soft, feet enlarged, numbness of left arm, icy cold hand, restless legs. Edema, hands soft, coldness of hands, left arm numb, legs restless. The general modalities are aggravation is from sun, noon, at noon, lying on the left side, going upstairs and physical exertion. So the aggravations are sun at noon, lying on left side, going upstairs and physical exertion. Amelioration is by rest, by sleep, fresh and open air. Amelioration, rest, sleep, fresh and open air. The C's and P's in cactus. C's we have already read. Caged feeling, constriction, congestion, contraction, collapsed and unclasped feeling of heart, cord around the chest, climacteric and congestive headache. Guys, and the headaches are more prominent during the climacteric period, that is on the vertex, pulsating on the right side, all that we have read. Climacteric and congestive headaches, cessation of menses on lying down. Peace, palpitations, pulseless, panting, prostrated. So, palpitations were found in the heart, pulseless, prostrated. What is panting here? Panting is nothing but quick and short breathing. There was difficulty in breathing, oppression of the chest, so the breathing was panting type. That was quick and short breathing was found. Hope the C's and P's of cactus are clear. Now we move on to the clinicals. The cactus is indicated in angina pectoris, arteritis atheroma of arteries, asthma, bladder, paralysis of brain, congestion of brain, hematuria, hemorrhages, headache, heart affections, intermittent fevers, melancholy, menstruation which is painful, that is nothing but dysmenorrhea, neuralgia, ovaritis, prostrate, rheumatism, sun, effects of sunstroke. Since the aggravation is from sun and the ailments are from sun, then the complaints from the sun and the effects of sunstroke, traumatic fever, vaginismus. Let us discuss two cases where cactus was indicated. A venereal correspondent patient came with the complaints of temporal artery swollen. They were hard to touch. There was pain in the chest like a swarm or hornets were going from the pectoral region to the heart. There was weakness and cold extremities. This is a solved case by Dr. Snader in July 1898. It is a cured case by him. The patient came with temporal arteries which were swollen and hard to touch. There was pain in the chest as if of the swarm and hornets, and the pain went from the pectoral region to the heart, and there was weakness and coolness of the extremities. Cactus was indicated and it cured the patient completely. Another case, the patient with the complaint of severe chills, rise in the temperature at 11 am. So, the periodicity of cactus is at 11 am and 11 pm. So, when the rise of the temperature was at 11 am, the person was thirsty, severe headache at vertex, no separate heat. Looking into the complaints and the symptoms, cactus was indicated and it is a cured case reported by Dr. Chowdhury. Both the case comparison, temporal arteries were swollen, hard to touch, pain in chest as of a swan and hornets which was going from the pectoral region to the heart, weakness and cold extremities, severe chill, raise in temperature at 11 pm. The person was thirsty, severe headache at vertex, no separate heat. What was indicated, guys? Cactus grandiflorus. With this, we come to an end of Cactus grandiflorus. Hope you like my video. If you like my video, hit the like button and subscribe to my channel. Thank you.